I am Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds. Good morning and Happy New Year. Welcome to the City of Lubbock COVID-19 news conference. Today, our panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Chancellor of the Texas Tech University System, Dr. Ted Mitchell, Family Practice Specialist and member of the Lubbock Economic Recovery Task Force, Dr. Josh Hill, and Lubbock Mayor Dan Pope. Let's start today with Catherine Wells.
Good morning, everyone, and Happy New Year. It's great to be back. I hope everybody had a wonderful holiday. Our numbers here in Lubbock are actually looking better, much better than what we're seeing across the rest of the state of Texas and across the nation. We're averaging about 250 new COVID cases a day. If we can continue at that rate and not increase it, I think we will be doing well as we move into the next phase, which is our vaccinations. I'm so excited that the health department was able to start our first large-scale vaccination clinics. Those started on December 28th, and to date, we have vaccinated over 3,400 Lubbock residents. That first clinic on the 28th and our second clinic on the 29th, we're focused on that 1A group. And as a reminder, that 1A group are our first responders, healthcare workers, home health, anybody that could become exposed to COVID by providing medical care to individuals with COVID. Then on Tuesday of that week, the Commissioner of Health opened up vaccinations to the 1B group. And with that, we were able to quickly expand who we were vaccinating and offered vaccinations at the Civic Center to that 1B. And that 1B group is those individuals who are over 65 or those who are under 65 that have a comorbid condition. We're looking at things especially like obesity, diabetes, those diseases that can make if they have COVID, likely increase their risk of hospitalizations. We're very excited to be offering these clinics. Our goal at the health department is as soon as we get vaccine in, we want to turn around and have a clinic within 24 to 36 hours. We received another large shipment or a shipment of 1,000 doses today, and we will be hosting a clinic tomorrow, and that information will be released later on. Again, we're excited to offer vaccine clinics here to the community. And with that, I'll pass it over to Dr. Cook.
Thank you, Catherine. And a New Year's blessings to everybody that's listening. Our hospitals remain full. Our numbers are coming down slightly. A few weeks ago, we had 90 plus patients in our combined ICUs. Now we're down in the upper 60s and 70s. So our numbers are coming down. We're still around 170 patients or so that are still in the hospital related to COVID instead of well over 200. This is good news, but our hospitals continue to be full. Our ICUs continue to be full. Now that we've made a little bit of room in the ICUs, we're having other sicker patients from what normally comes around during these time of year that patients need ICUs. So our hospitals are still at significant capacity. And please remember, we've lost about 600 members of our community. Our 600 people in our family and our friends have been lost to this disease. So it's still very real, and we must continue to respect this virus and its potential to cause death or to cause significant long-term illness that takes months to recover from. As Catherine said, it's good news that we've begun vaccinating people. We have two different kinds of companies that are providing vaccine for us, the Pfizer vaccine and the Moderna vaccine. Currently, as Catherine said, we're in 1A and 1B, and let me also help define that 1B category. As she said, it's 65 and older, or individuals who are 16 or 18. It depends on the vaccine manufacturer. So Moderna is 18 and older, and Pfizer is 16 and older, with at least one medical condition that puts you at risk for a significant illness, and that's cancer, chronic kidney disease, severe lung diseases, severe heart disease. This also includes obesity and pregnancy. And the American College of Obstetrics and Gynecology actually said they do recommend that pregnant women get this vaccine. And so please have a conversation with your primary care provider, your obstetrician, or your family physician that's delivering your prenatal care, to have a conversation about that if you think that you qualify for that. Please remember that this is 95% effective if you get both doses, and that's an important. You must get both doses. I know of individuals who received the first dose of the vaccine, got exposed to COVID, and came down with significant COVID illness. So it requires both doses of the vaccine to make sure in 2 to 3 weeks after that second dose before you're fully covered as best as possible. So make sure you get both of those doses. It is a very safe vaccine. And again, it requires 2 doses to become fully covered. The CDC did put out a recommendation that if you had a significant reaction that required epinephrine or something like an EpiPen, which is epinephrine, after you received the vaccine, if you had a reaction that required that, it is recommended that you do not get the second vaccine or the second dose. So we've had very little reaction. Most of them are the typical common reactions to this vaccine: soreness in the arm at the injection site, some low-grade fever, some chills, muscle aches, just kind of like a myalgias, or we call them muscle aches, those sorts of things. So you might expect that if you get the vaccine, when you get the vaccine. So just look out for those. Those are not severe reactions. It's where you have to have the epinephrine. So significant wheezing that we need to give you the epinephrine for. We are diligently working to disseminate and vaccinate all the vaccine that we receive. And you'll hear how much we've had. We've already given 3,000 doses out through the health department. This is fantastic news. And then lastly, don't put your guard down. We've got to hit 70 to 80% of vaccinated individuals in our community before we reach that herd immunity. And so we must continue to wear our masks. We must physically distance, and you can socialize even though you're physically distanced, 6 feet away from somebody. Stay in small groups and wash your hands. And we also have the antibody infusion drug. So if you're positive and you're in one of those high-risk groups, please call your primary care physician so we can get you in to get those bamlanivimab or Regeneron infusions in you to help you feel better. That concludes my part. And remember, nothing shows that you care for others except by wearing a mask and social distancing. Thank you so much. Let me hand this off to Dr. Mitchell, the Chancellor of the Texas Tech University System. Dr. Mitchell.
Thanks, Dr. Cook. Happy New Year, everybody. I don't want to restate things that Catherine and Ron have gone over, but it's important for everybody to remember that all of the data clearly indicates that there are a few groups that are the highest risk for problems with the virus, and those are the folks that are over 65 and those folks that have other illnesses as well, other comorbid states, and Ron described those just a moment ago, so I won't go back over them. But the idea behind using what we're calling the 1A and 1B approach to who's getting the vaccinations on the front end, keep in mind that while we're focused with these vaccinations on the 1A group, the healthcare workers, the frontline workers, and the 1B group, the group that we've been discussing above the age of 65 with comorbid states, the point behind that is to not only go after the folks that are taking care of us and go after the folks that are at highest risk for real problems, but keep in mind there's a benefit to the community by taking this approach. So if you really address the frontline workers and make sure they get vaccinated, then you reduce the absenteeism amongst those folks that need to be there taking care of everybody. And when you really focus on those folks that are older and that have other illnesses, not only do you help with them directly, but from a community perspective, you also reduce the pressure on the healthcare system. So you reduce hospitalizations, you reduce people having to be transferred to the intensive care unit, to be put on a ventilator. So there's a benefit to the community for addressing these groups first. I would ask that everybody be patient about this, because we're having meetings regularly with folks at the state level and the federal level, and more vaccinations will be coming. We should be getting enough vaccinations by the end of February, 1st of March, that we can open it up to more general populations. We've had numerous discussions about the logistics of where people go for vaccines and the like. But at the end of the day, we're encouraged. And when we're having this discussion, it's important for people to understand that the more folks that we get vaccinated, the faster we can, as a community, move back toward normal, as much as normal as possible, day-to-day lives. And this is a first big step in that direction. So it's like Winston Churchill said, this is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning. So with that, I'll turn it over to Dr. Josh Hill. Josh?
Thank you so much, Dr. Mitchell, for that introduction. I just want to take a few moments and speak to everyone in the community about the importance of us doing our part to ensure the safety and health of everyone that we're close to here in Lubbock, Texas. And this vaccine has been a real blessing as far as the medical community is concerned. And I just want to stress the importance of everybody doing their part and getting this vaccine and pursuing to get themselves immunized and protect themselves and those around them. I myself just received my second vaccine this morning, of the Pfizer vaccine. I've encouraged my family members who have been eligible for the vaccine to get those vaccines, and they've taken that advice and gotten the vaccines. And we've had really good responses thus far. Just some minor soreness, minor aches and pains, nothing really severe. And that's what we're seeing with our medical group and our hospital system. We haven't really seen very many severe reactions at all. This vaccine has proven to be safe thus far, and the efficacy and the data that we have thus far, by all means, shows really promising results as far as being effective to prevent people from getting the virus, and also to lessen the severity of symptoms if people do come in contact with the virus. As Dr. Cook alluded to earlier, it is absolutely vital that you not only get the initial vaccine, but also get the second vaccine. And the full immunity that we're hoping for, that the data is pointing towards, that 94 to 95% prevention of getting the virus, doesn't take place until about 2 or 3 weeks after the second vaccine. Your body takes time to mount an immune response and protect itself from this virus. And so it takes time. And so I just want to encourage everybody to be diligent, to be open-minded, and do what you can to protect yourself and protect those around you, so that we can put this virus in our rear view and start getting back to the way things used to be for the benefit of everyone involved. I want to wish everybody a happy and blessed new year. And with that, I'll turn it over to our mayor, Mr. Dan Pope.
Thanks, Dr. Hill. I'm also thankful for our team that's with us today, Dr. Mitchell, Dr. Cook, Ms. Wells. I just can't say enough about how much we appreciate your what you do for our community. I want to share a few data slides. I want to say welcome to 2021 first, though. It's sure I never thought I'd see a year I was more excited to get to than 2021. Let's look at 3 data slides real quick. Bear with me for a second here. Okay. First of all, this is the state's hospitalization rate. You're familiar with seeing these numbers Remember, at 15%, for when a trauma service area gets over 15%, it limited occupancy, closed down bars, et cetera. You can see this, I think, adds some data to what both Ms. Wells and Dr. Cook had mentioned earlier. But recall we talk about hospitalization rates, that even though COVID rates are going down, this is the time of year that hospital censuses, the people in hospitals go up because of cold weather and cold and flu season. Case count by age group. We're averaging about, over the last 14, 16 days, we're averaging a little more than 250 new cases per day. So that's positive. That's still too many cases, but it's fewer than what we've had experienced in the last 75 days. You can see where the cases are. Unfortunately, they're very spread out among all age groups. And then finally, hospital beds, remaining hospital beds. So this shows you on a daily basis that open beds and patients holding, and whether we have a surplus or a deficit. And you can see that for the last 3 days, we've had people waiting for beds at this snapshot time on a daily, when we get it every day. Okay. Stop share. I think I'm back. So let me make a few comments, and before I get into some details on vaccine. First of all, I want to share my words of empathy and sympathy to families and individuals and businesses who've been impacted by COVID-19. It continues to take a huge, make a huge blow to our community, and our thoughts and prayers remain vigilant for all of you, and it's important that I share that with you. I do believe that planning is an antidote, or the antidote, to panic. And we're working very hard to plan for an increased vaccine supply. So let me tell you where we are today. And I've got some notes I want to make sure so I don't miss anything. So the state receives a weekly assignment from both Pfizer and Moderna it comes through the federal government, of vaccine doses. They then assign these doses across the registered and approved providers around the state, and then they give notice back to the federal government and to the recipient, and then those allocations are shipped directly from the manufacturers, and they're posted on the Department of the Dish's website, where everyone can see how those are being allocated. Now, those assignments are made in line with the appropriate 1A and 1B guidelines, as Ms. Wells and Dr. Cook talked about earlier, in an effort to try to widely spread the distribution of these doses. At the local level, we have found that we have very limited lead time. In fact, 24 hours or so generally from time we are notified to when we receive the doses. All of the doses that we're receiving at the city to Ms. Wells' Public Health Department are the Moderna doses. Now, we are able to transfer within the city. And if you followed our numbers, you know that we've vaccinated many more people than we've received doses. And that's because we've had our partners share with us, and we're thankful for our health systems, for Covenant and UMC, for being a good partner in sharing doses with us that they could not use quickly, to allow us to get those doses in people's arms. We remain in very close contact with state leadership regarding Lubbock and our need for more supply. As soon as this occurs, we will have prearranged scheduled clinics for all the eligible population. Our number one goal is to make vaccinations available as quickly as possible and in an efficient manner as we can provide them. Later today, as Ms. Wells mentioned, we will announce a vaccination clinic for tomorrow. That clinic will run from 10 to 3 tomorrow. Our release, which will come out shortly after this press conference, will explain the two primary ways for you to get an appointment for tomorrow. One will be through our Select-a-Seat capability. Remember, that's our ticketing that we use for events, and we're not doing any events right now, but this is a free event. So it's not like you have to pay, but if you have a ticket, you're going to have a time to get vaccinated tomorrow. If you don't have access to the internet and you would prefer to call, we'll provide a phone number for you to call. We've expanded our bandwidth, and we hope that our phone system will support your phone calls. If you're unable to get through either one of those methods, we will have limited, let me underscore, limited walk-up ability. But our first priority will be to those that have gone and gotten a reservation. Now, these shots are free. We want you to have these shots. We hope that by the end of this week, we will be able to announce what could be a daily clinic beginning early next week and continuing into the foreseeable future. I had a chance on Monday to visit our clinic at the Civic Center. I was blown away by how well it was organized. We had a lot of community partners providing help that day also, school nurses as an example. I think the neatest thing about it was the excitement that I saw. I saw tears of happiness coming from many of our residents, our citizens, who feel like they're close to the end of their race when they get the first vaccine. They got to get the second one, but there's truly excitement, and that is wonderful. In fact, I ran into a friend as I was leaving, and he was coming in to get in line for his vaccine, and he texted me later that day, and he said, "It's great to see Lubbock citizens fighting back against this nasty disease." There is light at the end of the tunnel. It's a bit brighter today. That's the good news. We've got to stay the course. We need to stay safe. We need to be kind, and we must be hopeful. Lacey, back to you.
Thank you so much, Mayor. I'll ask the other panelists to turn on their cameras and unmute themselves, please. So we're going to open it up for media questions. And today our media order is Latino Lubbock, KCBD, El Editor, KLBK, Texas Tech Public Media, The Daily Toreador, The Avalanche Journal, and KMAC. So let's get started with Christy Martinez Garcia from Latino Lubbock.
Good morning, everybody, and congratulations on these vaccine clinics. They have gone well. My dad and two aunts got to do theirs on Monday, on the same day they buried their brother from COVID. So thank you. But here's what we did have issues with the phone lines. I'm glad to hear that more are going to be put into play. But how sure are you? I mean, I know it's a quick turnaround for us to get the message out, the media to get the message out, and then people calling in, but how sure are you that people are going to be able to call in?
Well, I can't tell you for certain that we can handle every phone call. That's why we're asking those that can to go online and use the Select-a-Seat option. Remember that we expect, we only have a few more than 1,000 doses on hand. So there'll be much more demand than there is supply, Christy. And that's why we're working so hard with the state to ensure an ongoing supply so we can not only do this on a more of an ad hoc basis, but on an everyday basis.
Catherine, I know that when we first started dealing with COVID, one of the questions that I asked was, what was the ethnic breakdown of those that were receiving testing? And now here we are receiving vaccines. What is the ethnic breakdown? And if you haven't already put something in place, will you? Because I think it's important to also collect that data, which, I know only 1% of the population has been vaccinated. And I think there's still time, but is that something that you plan to do or already doing?
The ethnic data is not collected with when you register for the vaccine and through that paperwork. My observation of working all of these clinics is I saw a very diverse group of individuals accessing that clinic. Older individuals, very frail, both African American and Hispanic community. I think the Civic Center is a place that everybody knows in Lubbock, and I hope everybody feels comfortable coming there to receive this important vaccine.
Thank you. I appreciate your time.
Thanks, Chris.
Now we move to Karen McKay with KCBD.
Happy New Year.
Thanks, Karen.
Let's say that I had 2 doses of vaccine to protect me against the virus. Then could I still pass the virus on to someone else as a carrier, even though I'm protected?
Dr. Hill, you want to take that one?
Absolutely. Thank you so much, Ms. McKay, for your question. To be frank, it's a little bit too early for us to be able to give you a foolproof answer on that. The vaccine is designed, of course, to prevent people from becoming infected with the virus. We do know that people still have the capabilities to carry some of that viral load and transmit it to others potentially. Our hope is that with the vaccine, we reduce transmission by reducing how many people get sick and also reduce that viral load to reduce transmission as much as we can. There's no clear-cut answer just yet. Our hope is that you would not be able to transmit it to others that you come in contact with, but it's just too early for us to know right now.
All right, thank you. And I have a question for Dr. Mitchell. The idea has been to give the vaccine to the people who need it most. How do college students fit into that? They're not high risk for getting sick, but they are high risk for spreading it. So when do you see a push for that age group to get vaccinated?
That's a great question, Karen. What we're looking at is, and we had some discussions about this yesterday, we're hoping that by mid-February, first part of March, that the vaccinations coming to us, the allotments that are coming to us consistently from the state and the federal government will be enough to open it up to the general public, which would include the students in that. As you know, one of the things that we've done at our system, at the tech system, is we've pushed back the classes at Texas Tech University. Classes got pushed back to January 20th, and in order to keep people at home during this period of time where, in the middle of winter, where people are clustered together and the like. So we will continue as the semester rolls out to be reinforcing social distancing, masks, hand sanitizing, things of that nature, just like we did during the fall. And then the idea would be, as more of the vaccine becomes available consistently, then we'll open it up through our student health services and things like that for the students.
All right, thank you.
Sure.
Thank you, Karen. Now we move to Olga Guerrero with El Editor.
Happy New Year. It's good to see everyone. And Feliz Año Nuevo. I have a lot of questions, but I know I'm limited, but just to let our readers out there to know that do expect a lot more changes as this goes on. A lot of people are concerned in the school field. They're concerned if all caregivers, all teachers, administrators that are going to be with our children, or even in the hospital, people that are working there, will they all be vaccinated? And for those that do not get vaccinated, will they continue being around people that are sick and still keep working, or is that going to be limited? Or I don't know how that's going to be handled, but if that could be, you could put some light on that, that would be great.
Look, you want to talk a little bit about healthcare professionals and how we've handled that? I can comment a little bit on the schools after that if you'd like.
Sorry, did you point to me?
Yes, if you don't mind.
I didn't hear the first part of it.
Yeah.
They're in the categories, and we're going to get those vaccinated. I know LISD has already made some progress in getting their teachers vaccinated, so we want them to get vaccinated. So yes, they need to be vaccinated because we do think that's important for them to do so.
The healthcare professionals, Dr. Hill, show us your button you've got right there on there today, and tell everybody, explain what that is, and talk a little bit about the process that you guys have followed for frontline healthcare professionals.
Yeah, Covenant or hospital system has been wonderful. I have a button that says I've been vaccinated, and has a picture of the coronavirus with the huge red line through it. Our health system, as soon as they got their allotment, they sent out mass emails to the providers within the hospital system and providers within Covenant Medical Group, our outpatient clinics. And we were all able to register online and reserve a spot to get vaccine at the hospital, at the Kniffling Center. And so that started rolling out, I believe, on December the 15th or December the 16th. And so I'm just one of the lucky folks that were in that first group. And I received my first vaccine on December the 16th and got my second one this morning. I haven't grown a tail and I'm still upright. So I'm really happy about that. And that's just the kind of, once we know how many vaccines we're going to have and how to best distribute those, I think more folks will have the ability and the capacity to get this vaccine. And that's something we're working really, really hard at over at Covenant. And I know our friends at UMC are doing the same. And we're just going to have to continue to do that every single day till we get everybody vaccinated that wants to get vaccinated.
We'll make a priority. Ms. Wells worked closely with Lubbock ISD this week. We vaccinated about 500 of their people. We'll make a priority as we have supply, we'll make a priority of working with our school districts to make sure that we vaccinate those of their employees that qualify in the 1B area. And it's important to us. We know how to do it. We just need supply, Olga.
Thank you. My second question is, I know that you said we're receiving, or the city's receiving the Moderna, but are we capable? Are we up to code? I mean, can we receive and be given the Pfizer? Because, Pfizer is a little bit more delicate. I know it requires the big old freezers and more time. Is Lubbock equipped if we were to be able to get some of that vaccine as well?
I'll take that one. So our hospitals, for Pfizer, the state really targeted our hospital systems because they have that ultra cold freezer. However, we have other options for ultra cold freezers. I have one here at the health department. So if they make that vaccine available to us also, we're capable at the health department to provide that vaccine to our community. But right now, most of that Pfizer vaccine is in the hospital systems.
Thank y'all. Y'all have a beautiful day.
Thanks, Olga.
Thank you, Olga. Now we have Terry Furman with KLBK.
Good morning, everyone, or good afternoon now, and Happy New Year. My question is this. If someone has had COVID and recovered completely from COVID, are they still encouraged when it's time for them to get a shot, or are they more encouraged to wait until others who haven't had it yet get it before them?
Dr. Cook?
Turn my mic back on. You bet. Thanks, Terry. Yes, we would still encourage you. There are some studies out there that say that roughly your antibodies may last about 90 days after being infected with COVID. There are some other studies that show it may be a little less than that. So certainly we would encourage anybody that's had COVID to go ahead and get in the line to get vaccinated when it's appropriate for your phase. So at least 90 days, maybe a little earlier. I don't think when it becomes your phase and you're available and eligible to receive the vaccine, regardless of whether or not you've had COVID, please get vaccinated.
All right, very good. My follow-up question, or my second question, is this: how are we planning to get the vaccine out to our homeless population in Lubbock?
Ms. Wells, you want to talk about that?
Yes. Our first priority is to get a regular shipment of vaccine into the community so that we can get the Civic Center up and running and being able to have multi-day clinics. After the health department gets that going, our goal is to have more targeted, we'll have more access to vaccine, and then we can go in and really work with some of these high-risk groups that will be less likely to access the Civic Center site.
Okay, very good. Thank you.
Okay, now we move to Sarah Self-Walbrick with Texas Tech Public Media.
Hello, everyone, and Happy New Year. My first question, what has been the biggest challenge of the vaccine rollout? And as we get some more doses, what is the city doing to mitigate that challenge?
Well, I'll start and I'll let Catherine add, but it's real simple. It's supply. If we had more supply, we could put more doses in people's bodies. And so we're working, I had 2 phone conversations yesterday with state leaders on this, waiting for response today on a question about more supply. So it's supply, and then relatively, I guess the other piece that goes with that is we do get supply, we have such short notice. Catherine, you want to add anything to that?
I would agree definitely with the supply. Sarah, we had the opportunity to walk through that clinic the other day, and we can vaccinate 200, 300 people an hour when that clinic is fully staffed up. So if I can have more supply, we can open up more appointments, we can accept more individuals into that system to get more people vaccinated.
That's a good segue into my second question. Amarillo's health department has received quite a few thousand more vaccines than we have. Those of you who have talked to state leaders, can y'all give some insight into how that panel is deciding how many doses of the vaccine goes where? What are they looking at?
Sarah, we've talked to them. I'm not certain that they can even give a good answer on that yet. I do know that the governor's office feels like it makes more sense to set up large scale vaccination operations like what you've seen in Lubbock and in Amarillo. And I believe you will start to see the supply to support those being readily available.
Okay, good deal. Thank y'all.
Thank you, Sarah. And just a note, Dr. Mitchell had to leave due to a prior commitment. So now we have Mateo Rosales with the Daily Toreador. Mateo, can you hear us?
Hello, can you hear me now?
Yes.
So sorry about that. So my first question is, with this new COVID-19 virus straining from the UK coming into America now, does this vaccine help prevent from that infection again, or is it still unknown at this point?
Can I help answer that? From all the studies that we've seen so far, we still expect that the current vaccine to work on that more infectious strain of this virus. These are directed at the protein coats or the spikes, and we don't think that that's the mechanism that's affected by the virus.
Okay, thank you. And Dr. Cook, earlier you said that there is a chance of possibility people that have already had COVID-19 to be reinfected. Can you more elaborate on that?
So if you've already had it and your antibody, our body makes antibodies to fight off the virus, and that's what the vaccine does too. We believe, and there are some studies that show that over time, your natural immunity to the virus, not related to the vaccine, but to the virus exposure, wanes over time. It falls off over time. And there are some reported cases that we've got individuals who were infected with COVID and became sick early on, then a number of months passed, and then became secondarily or sick again with a second dose or a second infection of the virus. All the more reason to make sure, regardless of whether you've had COVID or not had COVID, that you get the vaccine.
Thank you so much.
You bet.
Thank you, Mateo. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Mayor Pope, is it frustrating how slow the vaccines are being rolled out? I mean, the Moderna vaccine was approved by the FDA like 3 weeks ago, I think, and only 4,000 citizens in Lubbock have been vaccinated. Like, is it frustrating from your end?
Well, so the Moderna vaccine was approved the Friday, the 18th, I believe. We received our first shipment on Christmas Eve, I believe. Does that sound right, Catherine?
Yes.
So Matt, I guess I would agree. It's frustrating in the sense that I'd like everybody to have their vaccine today. I'm not very patient, but that's not real world. I think what you're going to see with this is a sort of a hockey stick kind of effect, and that is that you'll see it starts slow, and then I believe you'll see it really take off, and I think you'll see that around the country. I would imagine when we're back here next Wednesday, we'll feel much better about it, and I think it'll continue to progress like that. That's I'm hopeful. That's by nature, but I think I can see enough of what's happening behind the scenes to feel pretty confident in that.
Do you find yourself having to lobby? Do you feel like you're lobbying state leaders for more vaccines in Lubbock?
I don't know that we're lobbying, Matt. I think what we've got to do is prove that when we get vaccine, we get it in people's arms. And I believe that when we show we can do that, we're more likely to get at least our share.
Mm-hmm. So I don't know if this is a question for Dr. Cook or Ms. Wells, but so when is it going to become this big citywide effort that we're all kind of envisioning? I mean, I've heard nothing from my pharmacy or my clinic. All I'm hearing from is the health department. I'm assuming vaccines are occurring elsewhere, but honestly, I don't know where other than the health department. So
Catherine, you want to start with that one?
Yeah, please. And I guess let me rephrase that. So are vaccines occurring elsewhere in the city? And if not, like, when is that going to be the case?
So the first places that received the vaccine were our hospitals, targeting on those healthcare workers. And then just last week, they opened up the availability of vaccine to that 1B group, which is much more general public because it's either over 65 or those with underlying health conditions. I know Market Street, United has received vaccine, but very small quantities, 100, 200, 300 at each pharmacy. We've had a couple of primary care offices receive vaccine, but again, very small amounts. So I think it's very hard to set up vaccine clinics when you only have 100 vaccines. I think some of the thought now is that if we can bring vaccine together, have large, be able to put a lot of people through a vaccination clinic that's much more cost effective. It allows more people to get vaccinated. And I think the thought at the state levels changed from looking at giving it to lots of places to now looking at larger vaccine clinics. And I think that's the change we're seeing this week and hopefully more next week.
And I think I may be able to help just a little bit, Catherine, on that. Matt, thanks for your question. I think it's a really valid question. I know there's a lot of frustration in the community and also in the medical community about this rollout. Fortunately, at Covenant Medical Group at CMG, we're affiliated with Covenant Health System. So we've been allotted some vaccines for 3 Covenant Medical Group sites at the Northwest Clinic on Frankfurt and Erskine, Memphis Place Mall, and then also the Southwest Medical Park on 98th at Frankfurt. Now, we are aligning ourselves with the CDC guidelines as far as how we're targeting people for those vaccines. And so what we're telling our patients is if you're in that 1B group, we are trying our best as primary care providers and staff to reach out to those folks, to call them, to get them on a schedule at one of these vaccine sites and to administer those. Now, as you can imagine, we still, that's contingent upon the supply that we have. That's also contingent upon the resources as far as manpower that we have. So we are trying to reach out to our patients in that 1B group to get them set up and put on these vaccine schedules. And I would urge people in the public, if you are in that 1B group, it doesn't make sense to bombard these specific sites to try to get on a list. It makes more sense to contact your primary care physician. And we, as a Covenant Medical Group, are trying to partner with our community primary care physicians to enable a way where these community physicians that aren't affiliated with us can get those patients on a schedule as well. So it's going to take a lot of time, a lot of patience, a lot of man hours. And those are all dynamic things that are moving right now.
Dr. Hill, how far in advance are you scheduling appointments?
So we're again, that's contingent upon how many doses we have. Right now, we're scheduling for this week, for next week, the following week as well. And so again, the most effective way for people to get scheduled is whenever their primary care physician office reaches out to them to be compliant and get on that schedule. Or if you're in that 1B group and you haven't been contacted yet, you may reach out to your primary care physician and see if they have access to that schedule and can get you on that vaccine schedule. But we're scheduling for the next 2 or 3 weeks right now.
Okay, thank you, Matt. We have Matthew Snell with KMAC.
Thanks so much, Lacey. Happy New Year, everybody. My first question, really my only question today, is for either Mayor Pope or Catherine Wells. Did we anticipate the phone lines earlier this week to be overwhelmed as they did, or is it just that, just so many people were calling and wanting to get vaccinated, which is a good thing? Of course, now the Select to See option, are we hoping that will remedy some of those issues?
Yeah, we certainly did anticipate the demand, Matthew. We've done our best to provide not only more phone capability beginning later today, but also an online, access to Select to See. We think that will provide a better sources of access. Matthew, once we know more about the supply, we very well may schedule people further in advance, much like Dr. Hill was just talking about. But it doesn't do us good to schedule somebody for next week when we don't know if we'll have supply for them.
Got it. Makes sense. Thank you so much, sir.
Thank you.
Okay, thank you, Matthew. This concludes our news conference for today. Thank you so much for joining us, and thank you to our panelists and our interpreter. We will be releasing more information this afternoon about tomorrow's public health COVID-19 vaccination clinic. We will share that information with our media partners on our social media accounts and on the